Hi, my name is Jasmine Sujit. Today I want to talk about the intercultural communications. The purpose of this report is to find solution for the lack of intercultural communication skills among nurses. Intercultural communication skills are a set of skills that one needs to effectively communicate with others from different cultures or social groups. A lack of intercultural communication skills can often affect your workplace negatively. If your coworkers or patients are of different cultures, you will need to understand their tradition and cultural codes to make sure that you do not cross any lines while communicating with them. If you are working with elderly patients, by talking about their culture, you will be able to make them happier and form an emotional connection with them. One of the key concepts of intercultural communication is to understand the language skills are not only the skills that you need. Engineers need an understanding of their patient's culture and accept the difference in their culture to effectively communicate with them. Current teaching methods cannot effectively teach intercultural communications. A solution to the lack of intercultural communication is to learn about the various cultures that you will be exposed to at your workplace. This means having more content about native cultures in that country during training so the nurse can implement more culture appropriate care. In the graph that is shown, you can see the diversity of population in each of the provinces and territories of Canada. As you can see, the Aboriginal population is present in all the provinces and territories, which means that knowledge about their culture is very important because you will most likely encounter patients of Aboriginal descent at your workplace. In your workplace, you will be exposed to multiple cultures daily, and your knowledge of them is the key to being successful. Understanding a culture's tradition and history will ensure that you will not offend your patient in any way while you are communicating with them. For example, if your patient is Jewish, you would not want to unconsciously make jokes about the Holocaust or talk about their history lightly. By learning about these boundaries, you will be able to converse more easily with your patients. A study by Ingrid Hansen stated that the difficulty within intercultural communication is not so much language as the misunderstanding of customs. By learning your patient's customs and tradition, you will learn to appreciate them and be aware of them. Thus, you can make sure that your views and beliefs will cause or not cause a discord between you and your patient. Through this mutual respect, you will be able to connect with your patient through their culture and communicate more easily. Another solution is to change the structure and content of bridging programs in nursing. Most nurses are exposed to multiculturalism in their workplace, but if they are overseas qualified nurses, they will be exposed to a wider variety of cultures than their home country. Bridging programs allows nurses to be more successful when trying to get their license or certification. In these programs, they teach you language skills, intercultural skills, and counseling to thrive in your workplace. However, as stated before, intercultural communication cannot be thoroughly taught through normal teaching methods. There are barriers such as customs, traditions, languages, belief, and values that separate cultures. When new nurses are exposed to such a change in a short period, it can come as a shock to, due to conflicting cultural patterns of their own. This shock will often lead to lack of confidence and uncertainty, which cause the nurse to perform poorly at their workplace. By changing the structure and content of these bridging programs to include more knowledge about the native cultures, then the overseas qualified nurses will be able to cope better. how we can develop communicative competence. If nurses already have a thorough understanding of the native culture of the country that they are working in, they need to develop certain behaviors such as tolerance of other cultures and reduce ethnocentrism to improve their intercultural communication. Tolerance of other cultures refers to act of not only respecting other culture but also learning from them. By learning to value other cultures, nurses and their patients can form bonds based on this understanding and have effective communication. In a study done on overseas qualified nurses where most of the lack of intercultural communication is observed, one of the themes that recurred was perceived cultural hierarchies practiced in the country of origin. After eliminating these hierarchies, there was an observable change of reduced ethnocentrism, since their ethnocentrism held them back from engaging in conversation from whom they thought was superior. Their communicative competence also grew. In conclusion, intercultural communication cannot be taught through a didactic program. New structure and framework needs to added to the current training of nurses where more content about the native cultures of that country is added and less instructive teaching because intercultural communication cannot be taught through normal means. A side effect of such instructive teaching is the cultural shock which nurses have when they are exposed to a drastic change in culture. Therefore, a new method of teaching needs to be created where intercultural communication can be taught effectively. From this understanding of these cultures, nurses can begin to respect the different cultures and give culture appropriate care. Thus, they will be able to form a connection with their patients on an emotional which will allow them to communicate more efficiently. Thank you. Thank you for listening.